Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to cover the single leg glute bridge. So we do love this exercise, especially for building or just being able to engage the glutes a little bit better and getting used to that, building a little bit of pelvic stability, and then also a little bit of core engagement in these positions to keep the pelvis level and make sure that we're feeling in the right place. So let's get into it. So first position is starting on the back, just like you would a normal glute bridge. The only difference is going to be we're going to raise one leg. So we like it with the hip to about 90 degrees, knee flex to 90 degrees, and then we cue a little bit of like a pelvic tilt on occasion. Sometimes we'll keep the pelvis neutral, but sometimes we'll cue a little bit of a pelvic tilt just to kind of help place tension a little bit more on core and place the hip in a position where we have room to extend versus kind of being neutral or extended where it's just harder to kind of get a little bit of activation on that left side. So either neutral or a little bit of a pelvic tilt. We're gonna get that breath in. So breath in to brace the core, and then we're gonna kind of push through the heel, thinking about pushing our hip forward without letting that opposite hip drop, right? So we wanna maintain a neutral kind of stacked position of the pelvis, and then right back down. So the two things that we want to avoid with this kind of movement is overarching of the back, so letting the back extend versus letting the hip extend, and then not keeping that pelvis neutral, right? So we want to prevent any rotation. So just one more time, a little bit of a pelvic tilt, a little bit of a breath in. We're going to push through the heel, push through, squeezing the glute, making sure we bring it to a neutral position, not overextending, and then right back down. And then we can switch out and we can work the other side. So pelvic tilt, breath in, pushing through the hip to bring the hips level, and then right back down, okay? If you want to make it a little bit more hamstring dominant, we can create a little bit more room. So we place the heel a little bit further away, a little bit of a pelvic tilt, breath in, and then in that position, we should feel the hamstring more. If we're at a little bit more of a neutral position, that should feel like a little bit more glute activation, but we want to make sure that we're not going to bring the heel up so high that it's difficult to actually extend the hip because of tension in the quad and the hip flexor. So that's kind of the good position there, and I wouldn't recommend going too far above that. So that is the single leg hip bridge from the floor. And then we have other videos just in terms of some of the other options that make it a little bit more challenging or a little bit more aggressed. So you can check those out as well.